fissure sealants. So I know that's a common topic, mostly for parents.
Yes.
But for people who don't know what that is, what are fissure sealants?
On the surface, the teeth have got natural grooves. And for different people, the depth of the grooves normally varies. So those are what we call fissures. These grooves tend to pick sticky food. They get stained over time because it's difficult to take your toothbrush right inside those grooves, and they end up getting tooth decay. Before they reach to that point, we'll normally clean them out and then apply a composite-based material which flows into those grooves, and then we shine a light on it. It hardens and kind of seals those grooves so that now when somebody eats sticky food, then they don't stick into those grooves. And it makes it even easier to brush now that the surface becomes relatively smooth. Of course, after we do the sealants, we adjust the bite to make sure that the bite is still normal. One thing I like about sealants is that it's a very conservative treatment where you don't need to give an injection to the child or the adult, and you can do very many teeth in the same appointment, and you know that it is preventing disease, preventing higher cost of treatment a year or 2 years later on. Which teeth do we target for fissure sealant? Both the milk teeth and even the permanent teeth. Some kids, their teeth literally don't have much growth, but when they come, we check. If we find the grooves are deep, then we put sealants on them. But one tooth that we specifically like to make sure that we've sealed is the first permanent molar, which comes in at age 6. It erupts into the mouth when the child is still having the other baby teeth. So it comes just behind there. So normally, it is assumed that it is part of the milk teeth, yet it is a permanent tooth. So between that window of age 6 and when all the milk teeth or baby teeth fall out, between 10 and 12, that tooth tends to decay, and parents say, oh, it's one of the baby teeth that will fall out. But it doesn't. So by the time the child is age 12, if that's when they are coming to the dentist, we find that tooth is automatically decayed. So that is one tooth specifically we like to target. At age 6, immediately it comes into the mouth, we want to seal it. And when other subsequent teeth comes in, we seal them as they come in. The good thing with sealants is that they can delay the onset of tooth decay. You can find that a child probably is getting the first cavity when they are 20-something, just simply because they got sealants when they were 6, 7, 8 years old.
So does that mean that you would recommend sealants mostly for children?
Yes, we actually want to do sealants for children. In which case, if we do them for children, then in which case we will not need to do them when they are older. But if we find that the child missed even when they are in their teenage, and we find the teeth are still, they don't have any decay, we will put sealants. But later on, when they come and they are already stained, and probably there is a bit of what we call initial caries, instead of putting sealants, then we put a flowable composite. So you find that now for adults, we are actually putting in more flowable composite rather than sealants.
Okay.
Yes.
Okay. So I think that's going to be important for them. Something that we mentioned in the podcast episode. For people who want to check it out, kindly check the description.
Yes.
You mentioned, because I had asked you, what age is the best to bring children to the dentist? You've mentioned that some parents bring the kid at 12 years old, and that's already super late. That's
it's late.
12 years late, actually, because you were suggesting from a few months to maybe when they first receive their first tooth is when they should come and do that. So I think parents should heed your warning when it comes to when they should bring their children to the dentist.
Yes, because the sealants, especially the fissure sealants, for children, the baby molars normally would be coming in from around age 2 there up to around age 3. At that point, then we want to seal them. And it's a good experience for the child. No injections, yet you are doing a small filling for them there, and they see their teeth have become white. Yep.
They'll thank you later on.
Oh, yes, yes.
Okay.
I enjoy doing sealants.